Alternative to fillers? I have tried fillers in the lips, above and below mouth, and in cheeks and love the results, but they never last more than 3 to 4 months. What are my other options? Is there someone you could recommend in the Fort Worth, Texas area?
Thank you for your question. You've submitted a question without a photo, and so I'm going to try to give you some conceptual ideas of what you're asking. But you're specifically stating that you get injectable fillers in your lips, above and below your mouth, as well as in the cheeks, and you like the results and love the results actually, and you are a little bit frustrated by the longevity, that they only last 3 to 4 months. And so you're asking about other options. Well, I can certainly give you some guidance as to how I counsel my patients in my practice about situations like yours. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years, and injectable fillers is a very significant part of my practice, and I can help you understand the thought process that a lot of doctors use, myself included, and I think I can also offer you an option that still involves fillers as a strategy that might benefit in terms of long-term results. So in terms of the frustration with 3 to 4 month longevity, most likely when you're talking about that type of longevity, you're talking about the placement of a soft tissue filler such as Restylane or Juvederm Ultra, and placing it at the more superficial levels of the tissue. When you place these types of fillers, you want a correction, an improvement, and you want to avoid lumpiness. And that's why these fillers are designed in a way so that they minimize lumpiness and they can be placed relatively superficially. When people say, I want a longer lasting filler, very often that longer lasting filler tends to be a filler that's thicker. The problem with putting a thicker filler in a superficial area is that it has a tendency to look more lumpy and be problematic. Now, when it comes to the lips, in terms of volume correction, I think that you are potentially committed to a certain level of filler before it becomes problematic in terms of irregularities or lumpiness. So you may want to try an alternative option from a different company and discuss this with your doctor, and see which one maybe lasts a little bit longer. When it comes to the area of the cheeks as well as in the area of the jawline, I think there's something that's worth considering when you described below the mouth. And there is a concept that we apply to our patients when it comes to filler placement. It's called structural volumizing. You see, people want volume in their cheek area and their jawline, their chin. The challenge is getting the correction to look good and to give you really good youthful appearance. And so there's a distinction that I always make. If you put a soft tissue filler more superficial or into the fatty layer of the skin, you can only place so much. And it doesn't necessarily give you angularity, it gives you a little bit of volume. But you go above a certain amount, it tends to become too rounded, or it tends to kind of softly flatten out in a way that doesn't give you definition. Structural volumizing is a concept where we're placing the filler at the bone structure level. And this is something that most doctors don't do. And there is a very specific method to doing this. And when we place this at the bone level, the cheekbones look really, really nice and really well defined. And when it comes to longevity, the results can actually last a lot longer. So when we use, for example, a Juvederm Ultra Plus or a Juvederm Voluma, we can actually have longevity in the cheek area that can go 1 to 2 years, as opposed to the 3 to 4 months that you might be experiencing now. So the placement at that level may be a way to kind of balance out what you're looking for. So when I talk to my patients about this type of procedure, and the same applies for when I improve the jawline or the chin area, I'm placing it at a deeper level, and typically that tends to last longer. The more superficial, then you just have to accept a certain amount of maintenance as part of the process. It's really a combination of factors, and also understand that when you place these soft tissue fillers, sometimes or often the body does create some degree of collagen and response to that placement, and you may get some correction that's a little bit longer term. And sometimes my patients have actually said that it's starting to last a little bit longer, and it actually does occur. But everyone's an individual, and we have to always customize to their needs. So the other option that you could also consider is, of course, facial implants. But a lot of times when people are used to having fillers, they're not always crazy about the idea of having a facial implant placed. Since the fillers have improved so much over the course of time, then facial implants do still have a very important role. As a surgeon, I certainly use a lot of facial implants, but I can say just on the day-to-day desires of most people who want minimal downtime and quick correction, fillers have become very, very versatile, and it's the placement of those fillers and the levels and the artistry of placement that really makes a big difference. So I think that the take-home message here is learn more about structural volumizing for areas where the fillers can last longer and maybe even give you a better result than maybe what you're currently getting. Maybe explore some alternative fillers in the same category to see if one type of filler lasts longer than another, relatively speaking, and hopefully you understand the direct relationship between the thickness of a filler, the level that it can be placed, and the longevity of that filler. So I hope that was helpful. I wish you the best of luck, and thank you for your question.